SleepTech Talk is brought to you by Fisher & Paykel. Fisher & Paykel Healthcare is a leader in CPAP mask design and innovation for over 20 years. Their unique technologies have benefited millions of OSA patients through their top CPAP masks. These advancements continue to further enhance patient experience and outcomes.
SleepTech Talk is sponsored by React Health. Within our LunaPAP device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our LunaPAP device line while accommodating diverse patient requirements.
Lights out.
Welcome, everyone, once again to another episode of SleepTech Talk, the sleep podcast with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Moneycarode. Folks, thank you once again for all the love that you've provided us. We've got an amazing show for you, but we just want to say thank you so much for all the support. Be sure to share the show with even more people out there, all the sleep professionals and the sleep curious. Make sure you share it with them and continue showing us the love. We can't thank you enough for that. We also want to give a huge shout out to our sponsors, without whom we can't keep doing what we're doing. Shout out to them. Be sure to check them out as well. With that being said, Emerson, what's going on today?
Well, Jerry, we are lucky as always, but especially today, we've got a good friend coming in, Dr. Raj Dasgupta. A lot of our listeners have probably seen him pop up on The Doctors in the past when that show was around, and he's frequently seen on CNN and sharing advice about sleep. So, Dr. Dasgupta, Dr. Raj, thank you for joining us today. We are thrilled to have you with us. You've had quite a history and quite a story in sleep. One of the things we love to start off with is just, how did you get here? What made you think of sleep medicine when you were in medical school?
Yeah, well, you know what? It wasn't one of those stories where like, hey, from the minute I did med school, I got to go into sleep medicine. It was a journey. It started off with internal medicine. And I got to tell you, that's one of my favorite things in the whole world, is kind of like the base of all of medicine and able to integrate. And I feel that's what sleep is all about, integrating it with different organs in your body. So I did my internal medicine residency. Then afterwards, I did a pulmonary critical care fellowship. And then I thought, hey, that's going to be that, and that'll be it. And I'm done with all these years of fellowship. But at the time, it's amazing how time just flies. Sleep was a very, very big topic. And many of my mentors and colleagues were like, hey, are you going to sleep? And as naive as I was back then, I was like, well, sleep's got to be all about OSA and breathing, and that's why I went into pulmonary. So I did a fellowship at Henry Ford. They are awesome. And I realized during my training that sleep is a lot more than just breathing. Sleep is about parasomnias and insomnia and movement disorders and nocturnal seizures and narcolepsy. And oh my God, it goes on. And it just became such a big passion of mine, because one of my many sayings would be, whatever happens during the day is going to affect you at night, and vice versa. So it gives you kind of like the complete package. But anything good that happened to me, especially in the media world, happened because of sleep. So I always want to be so respectful, and it's just a great way to make friends. It's a great way to relate to patients. So thank you, sleep, for letting me be a part of you and being part of this amazing podcast.
Well, thank you for joining us. One of the things that I would imagine you have to do, I mean, you're on call with the major networks, and you have to stay up to speed on what is the latest subject, what are the latest topics, what are the hot topics right now. So when you're getting ready for these shows and kind of staying up to speed on what's next, what's hot, what do you feel like are the hot topics right now in sleep medicine?
Sure. I think the hot topics are going to be things that are super, super practical. So I actually just did one for ABC News here in LA. And the topic was, you guys are going to love this one. It was, when you walk into your home after work and you see that couch, are you, Emerson, falling asleep on the couch instead of the bedroom, and why? Tell me, is that not the cool topic right there? So I had to talk about why are people falling asleep on their couch and not their bed? And I think that's practical because I could see you guys and a lot of people listening going, dude, that's totally me right there. And the question is always going to be, well, why is your couch so comfy or why is your bedroom not? And is it because of your bed partner that's snoring too much? Is it because of your cute little dog that's jumping in your bed or that nocturnal cat that's not falling asleep? Or is there a primary sleep disorder that you possibly have? Or is your bed just not meant for sleeping? So, but of course, the big overall theme of that segment was I just think many of us are just sleep deprived for a variety of reasons. And I think that anytime you're falling asleep on the couch too often, that should be a signal that are you getting the two cues of sleep? And of course, you're going to ask me, what are those two cues? Are you getting the good quantity of sleep? And are you getting good quality sleep? And quality sleep, of course, is are you getting to the deep stages and REM sleep? And what is a classic disorder that does not give you good quality sleep? Of course, OSA, obstructive sleep apnea, which 40 to 50 million people have in our country. So these are like just timely topics that I love when people are nodding their head and kind of relate to it and that things that people have all the time.
Okay, so I have to admit you surprised me because I thought maybe you were going to talk about wearables or pharmaceutical treatments of obstructive sleep apnea, but not the quality of your couch and the difference in the quality in your couch in your bedroom.
No, man, and I'll give you another one. The one I just did with the Huff Post the other day. Have you guys ever heard of T-Rex hands?
Yeah.
Dude, I loved it. They're like, yeah, dude, Dr. Jerry knows what I'm talking about, dude. It's like if you're sleeping with dinosaur hands, arms. So what does that mean? It's kind of like, you can't. Oh, I guess you can see me. This is weird. This podcast is like videoed, not like my low budge one, dude. So, anyways, yeah, when you have these little T-Rex hands like this, and you're sleeping like that, is that a good thing, a bad thing? And a couple things. I wanted to do that actual interview because my son, Aiden, he has autism. It's moderate to severe. And a lot of autistic kids or kids with special needs do sleep in that position. I wanted to comment about that. But for adults like me and all you guys who I'm talking to, that when you have your hands like this long term, man, you can get some nerve damage, some shoulder damage, some neck pain. So you just got to be careful. You know what I mean? But it has a catchy name, and things that are very popular have catchy names. So yeah, this is another example of things that are really fun to talk about in the media. I'll throw another one out there and you're going to roll your eyes. I know Robert's going to roll his eyes. They made me comment about something called the Sleepy Girl mocktail. Have you heard of that?
Absolutely. No, certainly.
So
I
this
have
was a
not.
big.
I'd love to hear more about this.
All right, Dr. Jerry. So, I mean, supplements and other things. What are the hot topics out there? So, this Sleepy Girl mocktail, and this has been popular for about a year, and even more than that, was a combination of using tart cherry juice and mixing it up with some magnesium, and you put it like in a seltzer water. And tart cherry juice are one of the many things that kind of make you sleepy because it kind of breaks down into something that resembles or close to melatonin. So I remembered before I did the interview, I wanted to make sure I tried it. You know what I mean? Because I don't want to be just talking. So, I went to, I think I have Trader Joe's down here in LA. I got some tart cherry juice. And of course, it's not like a little sample size. It's like, a good half gallon. So I tried tart cherry juice. And you know what, Robert Emerson, it kind of tastes like crap. And now I'm stuck with this whole half gallon of tart cherry juice I can't get rid of. But when you mix it up in there, for some people it works. And a lot of people, when they want to inquire about sleep, they want to know just practical things I could just help out or things I could do on a rough day. So I love fun topics. So it's not always going to be about a wearable or about something super technical, but things that just people are curious about, and maybe I can make a little difference in their day or specifically their night.
So how in the world did you get into this sort of get the media presence that you have today? You probably are one of the most recognizable, on-screen physicians, I would think, in the country. And, the fact that you're involved in sleep medicine just makes it all the better for all of us.
Well, Robert, when next time I see you, I'm gonna give you a big hug. Thank you for saying that. But the truth is, so like Emerson mentioned, I was on the Doctor's TV show when it was being on when it was still around, and I remember my first episode was when it wasn't supposed to be me. So I think they wanted some other sleep doctor to come on, but something happened, and they were filming on the Paramount Studio lot in Melrose, which was about maybe not too far from USC, and they just come across my name. I had some videos in there because I'm always doing teaching. They're like, "Hey, Dr. Raj, do you want to come on the show?" And I'm like, "Sure, I'm in. When do you want me to come? How about in a few hours?" I'm like, "WTF? What do you mean in a few hours?" So, and I'm like, "And by the way, what do you want me to do on your show? And what's the topic?" And it was something called exploding head syndrome. I'm like, and of course, right away I go to Wikipedia, like, what the hell is this, dude? So, but anyways, if you want to be, if you want to be on media, and that is something, and I didn't know how fun it would be. I mean, you got to say yes, because if you say no, it's going to be someone else. So, I never been on TV before. I went down there, and you know what? I got got my 5 minutes. I loved it, and I thought that would be it. And then, long story short, 2 weeks later, they called me back. Then about a month later, they called me back again. And then before the show stopped, I was on the show like 60, 70 times, and I became their go-to sleep and pulmonary guy. And that kind of led to the probably my big break. What was that? There was a show called Chasing the Cure on TNT and TBS. It was hosted by Ann Curry, and I was her main doc, and I
Wow.
loved it. And then you know what happened in 2020? That stupid pandemic. I'm so
Yeah.
angry. Pandemic, and it was a live show, so it changed a lot. But I'm always grateful because, like I mentioned earlier, sleep opened up all these doors for me.
A sound sleep calls for a high-performing mask. Introducing F&P Nova Nasal with swing fit headgear. From fitting and seal to minimal noise and draft, it's performance defined. Go to fphcare.com/Nova Nasal to learn more.
That's awesome. And just to think, your career started around exploding head syndrome.
I know. Go figure. No, totally go figure.
They're
Go
like, we got to bring this guy back. If he could be an exploding head syndrome expert in 15 minutes notice or a couple hours notice, we got to bring him back.
Oh, and you would have loved it, dude. Because you always want to make things a little interactive and funny. And so the first thing I think I said on the show was like, "Everyone out there, don't worry, your head's not going to explode."
Nice, nice.
Nice.
But how do you come up with these things, these obscure things, but are still very interesting? And like for example, I've heard the whole cocktail thing, but I never heard it called as a Sleepy Girl cocktail. But to get these very fun topics, but understanding the science behind it, there are a ton of sleep gurus out there that come up with all this kind of garbage about how you can sleep better, but you're an actual physician and you know the science behind it. So how do you come up with these topics and ideas in order to help people sleep better?
So I am super spoiled because of all these great things we talked about. There are different companies out there, and one of my main, nicest, biggest company that does really cool things for me is called Sleep Populous, and I love them, and I'm their chief medical advisor. And a lot of these different queries that come out there, whether it be through HuffPost or Women's World or CNN, you name it, they go to a central hub and they kind of like say, "Hey, Dr. Raj is here and he's not busy here and he can address these things." And I just think that when you look at topics that you want to talk about, I think that it's things where you're not going to go and make an appointment and wait in a big line to talk about your jet lag with your sleep doctor. I think sometimes you need to realize that some of the first line defense are going to be things that you hear on a podcast like here, or things that you read in a nice article. So I think it's always the first step. I mean, don't get me wrong, I definitely have my super dorky moments, and what would be a big dork moment is GLP-1 agonists. I think that's one of the hottest medical topic out there. And for those who don't know, GLP-1 agonists have different brand names out there. We're not getting paid for this, anyone, but there's like Ozempics and Wegovys and Zepbounds and Mounjaros. And the big thing is that, people are using those for weight loss. And recently it got FDA approved for OSA, specifically talking about teriparatide, which I believe is going to be Zep bound. So many people have been asking me about what's the mechanism of action and how does it work and what do I think about it for OSA. So I think that when you do media, I think it's easier to be yourself and try to be funny when you're comfortable with the science. And I think that's why I love doing these fun topics, because of the fact that I always feel comfortable with the internal medicine background. I know that if I get put in, back in a corner and someone's asking me something that, oh, where did that come from? I feel confident to have that live conversation. So I think that's how it all comes together.
SleepTech Talk is sponsored by React Health. Within our Luna PAP device line, each offering is FDA approved, encompassing CPAP, APAP, bilevel, and bilevel ST models. Our thoughtfully selected array of PAP interfaces and accessories complement our Luna PAP device line while accommodating diverse patient requirements.
Thinking of dorky moments, I'll go a little deeper. What about meaningful? You'll have topics come your way. I'm sure you thought, okay, this is a little deeper than I normally go. What sort of one maybe stood out in your past where you go, this one meant a lot to me, was very meaningful, and it did some digging for you, to maybe even some soul searching, so to speak, but it was something that meant a lot to you as a topic you were able to cover?
Oh my God, that was actually just recently. So if you were to ask me, in my sleep realm, what is one of the disorders that I'm very passionate about? And it's narcolepsy. I think hypersomnia is such an important topic. I think narcolepsy is often underdiagnosed, misdiagnosed. I've had many patients that I love dearly, but I wanted to talk about one in particular because you asked me what made me take a deeper dive. I have a patient who has narcolepsy that is 101 years old. Yeah, I'm not even joking. And, true story, I actually am really happy to tell the story. So, I was giving a lecture one time about narcolepsy, and this was many, 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 many years ago. And after the lecture, apparently, the patient and the family came up to me. We shook hands, said hello, and we wanted to actually see me as a patient. And I really, really, really wanted to. And because of insurance and all these different things that factor in, we never really connected. And I would say fast forward years later, they finally got an appointment to see me, but by that time I switched hospital systems, so they missed it. And then at the hospital system I am right now, a patient got admitted because was having recurrent episodes of what everyone else was calling syncope, but it wasn't syncope. It was cataplexy, and it was cataplexy because she has narcolepsy. And if you are that age, and if you are going to have an episode of cataplexy that would make you fall, you're worried about a lot of things like breaking your bones. So what do we do in someone who's 101? All of us will have a couple comorbidities once you get that age. How do you treat it? Do you give a stimulant to the 101-year-old? Do you give some like sodium oxybate to that? You know what I mean? It's so hard. And, of course, I always love, talking to colleagues, talking to people who are smarter than me, figuring out what's the best thing for that individual patient. But it just reminded me, and what happened was I saw that patient not as a sleep physician, but as being with my internal medicine team. And they recognized me from years past. And they were so excited. And I'm like, I'm here now. And she's following me. She follows me in my sleep clinic. And this is one of the cases where, yeah, we're talking to others. We're having multidisciplinary, talking to the family to see what we can do to kind of help her out in a way where some of the medications we use for most individuals may not be the best for her. So that one was really special to me. And it's something I almost want to share with others. And do we have a moment? I'll tell you one other cool case. Can I tell you another cool case? Okay, so this one was really cool. So have you guys heard of the Inspire device? Does that ring a bell? That hypoglossal nerve, blah, 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 blah. So anyways, I got a really super cool patient who I love dearly who has Inspire device and doing well, no worries. It treated all the obstructive sleep apnea. But then suddenly he was not having the refreshing sleep, feeling tired during the day. Things weren't right. And of course, I'm going to cut to the bullet points and all this, but we found out that he developed central sleep apnea from the Inspire device. I know, I saw the wow right there, Emerson. It's a wow moment. You know what I mean?
Very much so.
Because when you have, what's called, treatment-induced centrals, we see that commonly from CPAP. You can have it from mandibular advancement devices. You can have it from anything, but it's not common to have it from this hypoglossal nerve stimulator. And this has like been years afterwards that he developed this. So of course, I'm hanging out with my good friends from otolaryngology. I'm talking to the Inspire team. We're talking to everywhere. It's multidisciplinary to figure out what we're going to be doing to help this individual. And anyways, not to get super dorky medicine, we came up with the idea that we'll start a very unique type of diuretic called acetazolamide, and it has been used in the past for central sleep apnea. And lo and behold, the patient is doing better. And the question is, well, what exactly caused those central sleep apneas? And that's what we're working up as we speak. So obviously, you got to invite me back on the podcast. You want to hear the conclusion of it?
Yeah. Oh, that would be fascinating because, you and I, the
Yeah.
first time we ever crossed paths actually had to do with back in the Auto SV days. You did a talk for Philips.
Yes.
And you were talking about, the SERV HF trial had just happened and everybody was freaking out, and you were speaking about it for Philips. And so to kind of hear you talk about that sort of brings this conversation full circle around, therapy causing central apnea like that. So that is fascinating. We definitely want to hear the rest of that story.
Be sure to check out our clinical sponsor, Sleep Review Magazine. More details in show.
Totally. And you know what? I'm glad the patient's doing well. And needless to say is that, it was one of those mottos in medicine, it's never good to be interesting. But, my team, the otolaryngologist team from the university center he sees, we're all teaming up together and writing this up and presenting it, at a, at one of these societies. So it's going to be good.
I have to admit, in my mind, I went to the Zoll remedy implant. So he's got dual implants going on at the same time, one to treat OSA and the other one to treat central sleep apnea.
That's hilarious. I hope everyone found that a little funny because when you have something that's wrong with you as a patient, you start Wikipediaing everything, and so he's like, Dr. Raj, no one's going to put another device in me. That'd be so bad.
Well,
yeah.
Doc, I'd love to keep this going, but we are out of time. I can't thank you enough. And yes, we need to have you back on. We want to hear the rest of the story. And it sounds like you're going to have a whole lot more for us next time as well.
Oh, definitely, definitely.
Well, thank you once again. And folks out there, thank you so much for joining us. This has been an amazing show, and I think it's been way too short. But until next time, we say cheers and lights on.